I believe healthcare is something, that all of us have got to be really interested in and excited about. We cannot afford the healthcare system to continue. And I believe, ladies and gentlemen, that 2009 is going to be the biggest year. Next year is going to be the biggest year of transforming healthcare. And why do I say that? And you're going to have other speakers up here say, oh, this can't be done next year. It's got to be done next year. Medicare starts going broke in the year 2012. That's 3 years from now. It'll be completely bankrupt by the year 2018. Medicare is a system that is crying out for help. And the federal government and the Congress and the presidential candidates are not talking about that. And I'm here to tell you that they cannot ignore it after 2009. Because every year that goes by, Medicare keeps getting worse. Medicare, as I've said, will go broke. And I want to give you just a couple of ideas how extensive Medicare is. The total gross national product in America is $13 trillion. That's all the goods, all the wages, all the consumption, everything is $13 trillion. The unfunded liabilities for Medicare over 75 years, which we have to look at in the federal government, is $68 trillion. You're going to have to raise the age limit. You're going to have to reduce services. And you're going to have to means test Medicare. Not everybody is going to be able, when they reach 65 or 66 or 67, be eligible for Medicare. It just is not in the cards. You can't. There's no way the federal government on $13 trillion is going to be able to come up with enough cuts in order to fund a $68 trillion deficit in the future. And Congress doesn't have the capabilities of dealing with that. So I've asked the presidential candidates to look at a base closing commission. Equal number of Republicans, equal number of Democrats, to come together in 2009 and make these tough decisions. And then allow Congress either to vote it up or vote it down. You can't, it's just not logical to expect a Democrat or a Republican to go into the House of Representatives, the United States Senate, and say, my program is to cut benefits in Medicare. Or I want to raise the age of eligibility. Or I want to means test Medicare. That's not the kind of platform a candidate or a congressman or a senator is going to run on or get reelected in the next election. And so I look at Medicare and I say, ladies and gentlemen of America, and especially you in Congress and presidential candidates, you got to look at this thing, you got to fix it. We cannot allow Medicare to sink the healthcare system, which it will if we do not fix it before 2015. And that's how serious it is. The second thing is S-chip has just been continued till March 31st. The Medicare hole, the fix-it bill this year, is twice as much next year. And then you look at the fact that healthcare has taken up 16% of the gross national product, is going to take up 21% in the next 5 years. And we've already seen what healthcare costs are doing to General Motors. You just stop and look in your own states. You all come from different states and different backgrounds. Just look at the businesses that are exporting. We spend 16%. The Japanese, the second largest economic base, spends 8.5%. China, which is fourth largest, spends 2.5% to 3%. You're not going to be able to compete if we go to 17%, 18%, 19%. Our companies that export will not be able to compete unless our dollar is so depreciated it's worth nothing. And I don't want that to happen. So we have to fix healthcare. So now I've told you what's wrong. Let's take a look at, we're Americans. And we got that spirit about us, we're pretty darn good. we can find fault with ourselves. We can find fault with our country. But I'm one of those individuals that love America and believe that America is a great country. And we really do try and do what is right. Oh, we make mistakes. Who doesn't? But the truth of the matter is, we have the opportunity as Americans now. Things are so bad. Now's the time to fix them and make them better. So let's take a look at healthcare. What's the one area that's causing the most money? And you have to go, if you're going to fix something, don't you have to go where the money is? Doesn't that make sense? It'd be nice, if we could just pick on those big drug companies and blame them, but the fact of the matter is, drugs companies only 12% of the problem, or 12% of the cost. And they're not the problem, I don't think. And so we gotta fix it. What is the big cost? 75 to 80% of healthcare goes for what? Goes for chronic illnesses. Goes for chronic illnesses. And illnesses that you and I have some control over. And wellness and prevention and disease management happen to be the three areas that Democrats and Republicans all support. There's bipartisan support for these areas. So let's take a look at it. When Jesse James and Willie Sutton asked, why do you rob banks? What was their answer? That's where the money is. So if we're going to fix health care today, let's go where the money is, and that's chronic illnesses and disease management and wellness. And the first one is what? Tobacco. Tobacco, $160 billion a year out of that $2.4 trillion. 440,000 Americans died last year from tobacco-related illness, 440,000. And I know some of you still smoke in this room. I'm not going to preach to you. I just wish you wouldn't. And if I told you, ladies and gentlemen, to walk from, if you were a smoker, to walk from that door to that door over there, that wall to that door, along this line, and if you did that, you'd give up 15 years and 6 months of your life, how many would volunteer to do that? None of you would. Heck, I'm making money. I want to spend it. I don't want to leave it for my grandchildren. And I want to see if the Green Bay Packers go back to the Super Bowl this year, with or without Brett Favre. So I don't smoke. And you know something? Those individuals who smoke, 60% of you are going to give up 15 years and 6 months of your life. That's too much. Life is great. We got too much to do. So I urge you not to smoke. I used to go around the department when I went into work in the morning, policing department. I saw smokers, I'd go over. As secretary. I wouldn't ask you to do this, but I went over to the secretary, took cigarettes out of people's mouth. We got slapped a couple times. One day I walked around, this elderly man was about ready to take a big drag, and he didn't know what to do, so he stuck it in his pocket, and his shirt caught on fire. He quit smoking. Then I got so frustrated, I made all of the smokers cross the street and go over to EPA and smoke. Now that was a real downer. But I accomplished my objective, and we reduced the smoking and consumption. How many of you take a baby aspirin for your circulatory system? I do. The President of the United States does. You do, from Johnson & Johnson. Several of you do. I'm not going to have you raise hands, but you should. 84,000 people are going to die this year because they don't take a daily aspirin. Fact. And you know something? Baby aspirins are regulated by FDA. You know that? Nicotine, which killed 440,000 Americans last year, is not. Now, does that make any sense at all? Absolutely none. Government hasn't had the courage to regulate nicotine, which killed 440,000. The next one is diabetes. Huge problem, especially with minorities. Last year, in 2007, 18 million Americans had type 2 diabetes. This year, 22 million Americans. And what scares me, ladies and gentlemen, there are 41 million more Americans out there that have type 2 diabetes. Some of you. And in 5 years, unless you correct it, there will be 62 million Americans that have type 2 diabetes. And that will go to $400 billion a year. Can we afford that? Absolutely not. My department, HHS, did a study and found out if you walk 30 minutes a day, lost 5 to 10% of your body weight, you would reduce the incidence of type 2 diabetes by 60%. That's a huge savings. And we have to get that information out there. I tell my corporate clients, I says, hire a nutritionist, bring them in. I also said, go into your lunch counters and put in 2 lines. Subsidize the fruits and the vegetables and the non-fat foods. Give it away or subsidize it. And in the high-fat line, charge $5 for a hamburger, $10 for a cheeseburger, and 20 cents per French fry. You know something? You will change human behavior. And you will start fixing the problem. It's not rocket science. The third one, of course, is, is obesity. I know we can look ourselves in the mirror and say chunky's good. But slim is better, and we know that. And all of us can do something, I started a new diet. You know that there is no law in any state yet that requires you to eat everything on your plate? There are no food police in America. So when you go into a restaurant, take everything you want, but only eat 50%. You make everybody satisfied because, you tried something. You just eat, you just have a little self-restraint and only eat 50%. Nobody's going to arrest you. And you lose weight. I lost 15 pounds. I know it hasn't improved my looks at all, but I'm stronger and better, and I do some exercise. I do 50 push-ups in the morning, 50 push-ups at night. I could only do 5 when I started. And every one of you can do that. And then you see I got a bandage on my face, skin cancer. It's called prevention. It's called wellness. It's taking care of yourself. It's going in and get your mammogram, your colonoscopies, your skin taken care of. Every single one of you do that. And I'm not going to raise questions or raise hands and say how many of you had your annual physical, but every one of you should. Especially individuals in the healthcare field. You should be examples for yourself and your families. And especially for African Americans and Latinos, especially males, minorities who never want to go see a doctor. We have a tremendous opportunity. Second one is disease management. 20% of the people that I've been talking about spend 80% of the cost of health care. Most of those are severely ill, disabled. But we don't manage their diseases. Medicaid, one of the biggest problems in Medicaid is the cost of their special needs people. And if states are going to be smart about it, they're going to have to address them, get them into some kind of managed care or some kind of disease management. And you can reduce that. If you reduce it down from 80% to 60%, you're talking about real money. And instead of expecting the drug companies to increase their drug rebates, you should do what is necessary to give people good quality of health and go in there and take care of people that need it.